Marcos Munoz.
Melissa Munoz.
Miguel Munoz.
Aging is unfortunately a part of everyone's life. I know lots of you don't want to hear, including myself. I don't want to hear that I'm getting old. Who wants to get old? Along with aging, unfortunately, there are plenty of things that come along with aging, like diseases, wrinkles, of course, gray hair. But today, I'm going to go over some diseases or some things that can go wrong with your spine. I'm going to present to you with some information that I have gathered from 4 neurosurgeons at Methodist Health Systems in Dallas, WebMD.com, and Brain and Spine Institute, also in Dallas. Aging of the spine can unfortunately be painful, uncomfortable, but definitely treatable. I will be going over 3 diseases, like I said earlier, that could be treated, but that do appear due to age. First, I will educate you on spinal stenosis, which is a very common problem that normally occurs with, of course, the aging process. Spinal stenosis is a narrowing of the spine, which causes pressure on the spinal cord and on the nerves. About 75% of the cases occur in the lower back area, right above the buttocks area. Some of the symptoms when you're dealing with spinal stenosis are frequent falling, clumsiness, pain, of course, and difficulty walking, as well as tingling and numbness all the way down into your leg, and it could even go down into your feet and toes. With spinal stenosis, you don't have to have any kind of history of back problems. It's just something that just comes about with aging, unfortunately. There are a few treatments. Physical therapy is one of the treatments that can be done to that can take care of the spinal stenosis. Anti-inflammatory medication. Of course, there's steroid injections. That is kind of like a Band-Aid that can occur as well. But it isn't recommended because, like I said, it's like a Band-Aid and it stops the pain for a very, very, very short period of time. Although it can work for a couple months, they just don't recommend it very often. If none of those seem to work, of course, surgery, unfortunately, is the only other option that there is. I know lots of people are nervous about some surgeries. But nowadays there's so many kind of surgeries. There's minimally invasive surgeries that, I mean, you're in and out of there in a day, depending on what kind of case you have. But it's not nothing. Of course, everybody's going to worry. There are risks in every surgery, but at times it could be fixed in a couple of hours, and you go home later that day. Another disease or problem that could occur with your spine is a herniated disc. Herniated disc is when the bones that form the spine in your back are cushioned by small spongy discs. When the discs are healthy, they act as shock absorbers for the spine, and it keeps the spine flexible. When a disc is damaged, it may bulge out and, you know, kind of stick out and kind of pinch the nerve, which causes the pain with herniated disc. Symptoms of herniated disc are pain, of course, numbness, and weakness. That does occur as well in the area of the body where the nerve travels. That's normally where, like I said, it pinches the nerve, so that's where the pain normally is. And the sciatica, which is the most common symptom, the area you will have the most back pain and numbness, and also which is in the leg and then into the buttocks area on the back and down onto the leg. There are a few ways that could be done, or that could fix a herniated disc. First is resting. If you have severe pain, you know, kind of lay down and take it easy for a day or so, but don't lay too long, because then that could cause that could just cause weakening in muscles, and you don't want to do that. You don't want to make it worse. Walking makes it better, and light exercise may help. Also, you can also use a heating pad, like this one here. You just plug it up into the wall. It says to use a heating pad for about 15 to 20 minutes every 2 to 3 hours on a medium setting, and just lay it on the area where it hurts, back, leg, wherever it may be, and that's a form also to take care of it. Or an ice pack also for the same, about 10 to 15 minutes every 2 to 3 hours may also help. But just don't use the ice pack so much. I did have a coworker that would use it frequently, and it actually ended up, she has like a little rough area there where she used to place it for such a long period of time. Also, physical therapy or any exercises that is recommended by your doctor. 1 in 10 patients with a herniated disc end up having surgery. So it's something that could be taken care of without surgery, just depending on the case. If it's just untreatable or it's just too bad, then of course surgery is the way they're gonna want you to fix it. Finally, I will inform you of spinal compression fractures. A spinal compression fracture can be caused by having osteoporosis, which is another form of aging, normally in women over 50, and that are going through menopause are the ones that are at greater risk for the osteoporosis, which could cause the spinal fracture, unfortunately. Symptoms of spinal compression fractures: sudden and severe back pain, worsening of pain when standing or walking, difficulty and pain when you're bending down or kind of twisting your back and twisting to lift up something. That's when you're really going to feel the pain, or loss of height is another big one. Treatments for spinal compression fractures is activity modification, kind of change up. If you don't exercise, start exercising. If you're exercising too much, then kind of lay back from it. It could be that's what's causing it. Back brace, it provides external support to limit the motion of fractured vertebrae, much like applying a cast to a broken wrist or a broken leg. It's just kind of molding it there in place again for it to get better. And of course, the surgical treatment has to be done. If the activity modification and the back brace isn't working, then of course, then unfortunately would have to go to a spinal surgery. The two that are mostly done surgery-wise is a kyphoplasty and a spinal fusion, which is where they fuse the bones together, put some screws in there to kind of hold it in place, and then they do x-rays for about a year, every 3 months, 6 months or so, to make sure that everything's fusing on is looking good. Well, let's go ahead and summarize what we've gone over today. I know I just went over some things we don't want to hear, which are things like aging, and our body having to go through things along with aging that we do not want. Unfortunately, the spine is something that can be affected by age, which I just went over 3 ways it could affect it, which is spinal stenosis, herniated disc, and spinal compressions, which is normally caused by other diseases that come with aging, like osteoporosis. Well, we just went over the 3 diseases. I know that aging isn't something we want to go through, but unfortunately we have to. And if any of you are having any of the symptoms that I've mentioned, please seek a doctor, and just to make sure everything's going well.